So I just want to talk a little bit about CSOM, but first, again, like everybody else, to thank the CCLG for funding this, because actually this is a project whereby we've tried 3 or 4 different places to receive the money, and we've received it now, which is great. And it's a multi-platform interactive communication aid that we want to work with children to use it to help them in healthcare encounters. And what I thought I would do is I'm going to show you what it looks like, because it doesn't take very long, and then I'm not going to say so much about what we're going to do. I'm going to shorten that section, but I think it would be really nice for you to listen to this. And it's not very long. I should come up there.
Hi. CSOM is a computer program that helps children to tell about how they are feeling. Choose boy or girl. Now you can decide how the child looks. You are now ready to start. At the hospital, about your body, thoughts and feelings, things that are difficult to manage, things one might be afraid of. Click on the island you want to go to. In this room, you can tell how you feel about things you have to go through. How is it for you to get shots? How is it for you to remove stitches? Are you afraid of getting nightmares? Are you afraid without knowing why? How I look. Show where you have pain or discomfort. You can see all your answers. Are you done? Please give CSOM to the nurse.
So although by the time you get to see it, it may look a little bit different because it's been refined all the time, that is in essence what CSOM is. And I'm going to skip over some of these deliberately because I think that in essence of time. So there was one study which is now nearly finished, and working with Susie and the person who developed it, who's in Norway. And for this first study, we're really looking at the pictures, the words, etc., and getting children who've not had cancer as well as children with cancer to tell us whether it makes sense or not. Because I'm sure you heard in there was the word shots. Well, in the UK, we don't use shots, except I think they do in Scotland, I have a feeling, or somewhere. So that study has finished, nearly finished. We're just doing the final bit of testing. So this is telling us something about the words that are used, I say, in the pictures, and then we will ask the team in Norway to make those changes to the program that we will be using. And then what we've done is we've expanded the team for study 2, which is the one that CCLG are funding. And Jess, you've just heard from here, Bob Phillips, Susie, you've heard from this morning. So we've got the study team 1 still working together with the team in Norway. Then we've added some people on. And Tina Baggett has done some work in the States, doing similar kind of work to see what children think about using CSOM, and a couple of people from Great Ormond Street. So the platform itself exists, but it's not in use. So there's a couple of things you can do, of course, is you can research it and see what benefit there is from it, or you can just research it and see what people think about it, rather than necessarily doing a study which might take you 5 years. And remember, it takes, I think it's 23 years to get research from finishing into practice. So if it takes us 23 years to get this into practice, I'm off. So we really need something a little bit quicker, really. So what we're looking at here is whether we can implement into practice, just get people to use it, find out from children what it's like, find out from parents what it's like, find out from professionals what it's like, get it into practice in a daily practice, in a clinic, in a ward setting. Let's just learn about using something in practice. And if we can learn some of those things up here, then it may well be then we can get some funding to take it out to a bigger study. But actually we need to do this first bit. And to do that, we are doing it in 2 centres. So we are doing it in Leeds and Great Ormond Street. So that will be an inpatient unit and an outpatient unit. And we're doing what's called a process evaluation, which is really what I've just said, is we're learning how people use it in practice. So we will use interviews, questionnaires, we'll observe interactions between clinicians, nurses and parents, and we'll just see what happens in those things and ask children in particular how they've used it. Did it help them? Did it not? And to do all of those things, we'll understand more about its uptake and its impact. But in essence, and this is the bit that I think is important, this is what it's trying to do, or this is what it's been shown to do, this is what we want to see if it does that here in the UK. So it can lead to better discussions between children. And there's a suggestion that often children are not included in some discussions, particularly younger children. Does this help them to be participating more? Do we get to the point of what the child wants to talk about instead of talking about what everybody else wants to talk about? We can discuss and initiate treatments earlier, follow-up care, referral. Some of those things might happen earlier, so referral to a psychologist may happen because the child has given us much more information. And it may help children that it can prompt and recall questions. So it may be, instead of a parent saying, there was something we were going to think about asking you, they've got it in front of them. They've got the report about some of these things children have been saying they've been experiencing. And that could be a fatigue, it could be all sorts of symptoms, or it could be just feeling down or fatigued, as we talked about before. It could help to for the child or young person to share information between them and their parent when they're at home. And we can use the reports, and hopefully we'll get to a point where we have got a system where you can download those reports and they could go into a child's notes, and then there could be discussion when they come back, looking back on what happened before. So I guess the summary is that we think this has got huge potential. We would like more things that enable children to participate in discussions with clinicians, in discussion with their parents. It may enable parents to have better conversations that help them to describe some of these things, because all of this work and the work that they did in Norway is underpinned by asking children. So the body of evidence is really strong that these are the things that children want to know, and these are the kind of words they might use. So I guess watch this space. It won't look like that. It'll look a little bit different, but hopefully at some point beyond next year, when we've done some early work to find out whether it works, then hopefully we can just get this thing into practice, because it is available already in Norway. People can just download it, but we want to at least know that families and children like it. So short and sweet, but thank you so much for listening.